Morning, Robin, and thank you. I'd like to say hi to all the faculty and the participants, the attendees. Good morning to everyone. Well, I want to organize my thoughts here. To answer your question, Robin, when we look at orthopedic care in a time of crisis, for me, it really focuses on what does the world need from us right now? And I sort of group that into four C's, if you can remember 4 points. One is connection with our colleagues. Number two, I'd say, is connection with our patients. And then the other two are more humanitarian. Number three, I'd say, is the way that we connect with our loved ones at a time like this. And number four is our development of our character or our social interaction. So number one, connection with our colleagues, it's the people that we work with that we love so much, whether it's our colleagues in the operating room, our reps, our PAs, our other physician colleagues that we see in the office. And that looks different at this time. So connection in this time it's the same principle, it's just remote. So you've jumped onto this masterclass, treatment strategies for patients with delayed arthroplasty. That's one way to connect with your colleagues. The Academy has a sponsored orthopedic response on COVID-19 that's going on the next 2 days, and I'll be jumping on over there when this conference is done. Take the chance to reach out to your PAs, to your reps, to the people who are upstream or downstream from your work line, and let them know that you care about them and that you want to know that they're doing okay and that you're not going away, that you're here for them both before and after this epidemic. Number two is connection with our patients. And this is what we all truly love, is patient care, right? And that's what stings a little bit during this time, is that as orthopedic surgeons, we maybe feel like our usefulness isn't being put to best use the way it is that when we're not in a time of epidemic. It's what we truly love. That connection doesn't necessarily need to go away, but by necessity, much of it becomes remote. And my encouragement is we just need to adapt. So I had never done a telehealth visit before last week, and we're up and running. We're seeing patients every day via telehealth. I'm also offering patients injections. So I'm going into the office 1 day a week, and we're doing a lot of injection. Obviously, the risk factors for your patients depend on their age and the prevalence of COVID-19 in your area. So use your sense of judgment. But for me, 1 day a week in the office, offering injection to patients who otherwise would be suffering is a great way to bridge the gap. In terms of what we're using, we know from good phase 3 pivotal trial published in the Journal of Bone and Joint Surgery in 2018 by Conahan and Associates, that using an extended release triamcinolone provides excellent pain relief. And our exploratory endpoints of WOMAC and KOOS subscale show that the relief we get at 4 months is about equivalent with extended release triamcinolone to what we get with crystalline suspension or short-acting triamcinolone at 1 month. So this is something to consider when we think about how can we bridge the gap for patients over a time frame that may be longer than just 1 to 2 months. And that's what I'm doing a lot of in the office on the 1 day a week that I'm in the office. In terms of number three, I would say the most important thing I'm doing, Robin, is trying to make a connection with the people in my life that are outside my orthopedic world. So the day before yesterday was a 70-degree sunny afternoon here in Texas, and I can't remember the last time I went fishing on a Tuesday afternoon with my high school son, but that's exactly what we did. And whether it's call your parent, call your child, write an email note or a text to a friend or a loved one, I think that one of the things that we can do during a time like this is reconnect or re-engage in a way that we haven't previously. And then number four, I think the way that we stand tall in a time like this is via character. Each of you that are on this call have an exceptional ability to learn. You have the capacity and the material on the pandemic that we're going through right now. You have the ability to coalesce and summarize information. And then finally, each of you has a circle of influence that needs your thoughtfulness and your stability right now. And that combination of coalescing of information and thoughtfulness and a physical and emotional stability can be a tremendous benefit to the people around you. So in summary, I'd say as orthopedists right now, what the world needs from us are really 4 C's. Connection with our colleagues, we need to stay sharp. Connection with our patients, be a source of help for them. connect with your loved ones, re-engage in places that you may not have been engaged recently, and in terms of character, be a source of hope and stability for those around you. And that's really the summary of my thoughts, Robin. I'll